When I had that seizure, I'm like, who knows if I'm ever gonna be a police officer again. I was devastated. My name is Cella. I was diagnosed with epilepsy in 2020. I ultimately had surgery 2 years ago at Robert Johnson University Hospital. So I was in the police academy, Monmouth County Police Academy, 2023. I was doing PT, so PT is physical training. And all of a sudden I go down with a seizure. I remember waking up to instructors, the ambulance, EMTs over my body, and I just look at myself and I'm like, I'm done. And I worked so hard to get here. You know, I changed my career path from being a special education teacher to being a police officer because it really was my dream. EMTs took me to an area hospital who referred me to Dr. Ron Manny at Robert Johnson.
Alex had been dealing with seizures and epilepsy for a few years. I saw him for a first visit with Alex's intent and expectations to make this go away.
He said, Alex, listen, every medication you've been on so far are what I call the big dog medications. And those are all the big medications that I put people on to stop epilepsy. And you've been on every single one of them. So me trying you on another medication, the likelihood of it working is not very good.
He had a lesion on his MRI. We didn't know what that lesion was. We didn't know where else in the brain the seizure was affecting. So we did our standard workup for Alex that was non-invasive, which included a high-resolution MRI, a brain PET scan. We had him get cognitive testing called neuropsychology testing. All this helps us understand better where the seizures may be coming from and how they affect the brain.
He said, the best bet for you is gonna be brain surgery. My biggest decision on it was I asked both doctors, I said, Doc, what are the chances that I can be a police officer again? They said, Alex, there's a chance.
The goal of the surgery is to find the area of the brain where the seizure is coming from and determine the removal of that area is safe for the patient, meaning that the removal of the surgical focus will not lead to any neurological, psychological, or cognitive setback for the patient.
I was scared. I really was. But it ended up being the best thing that could have ever happened to me in my entire life.
So after that surgery in 2023, Alex has done awesome. He has been seizure-free. We've done a stepwise approach of reducing his seizure drugs significantly, and he's remained seizure-free.
You can put me in service for
We're very happy with his outcome. He continued being monitored by Dr. Manning, but the fact that he hasn't had any seizures since the surgery is a good indicator that he is likely cured.
I lived a life that at one point I didn't think I was gonna be able to live. The chance that the surgery didn't work was there. And that's what went through my mind every single day after my surgery until I was told that you are cleared to be a police officer. You know, there's a few days that you could say is the best day of your life. One day when I'm married, one day when I have a kid, but I can most certainly say the day I was told that the surgery worked was hands down the best day of my entire life.